Zaleplon is a medication that is classified as a sedative hypnotic. It is well known under the brand name Sonata. It is used for the treatment of insomnia for a short period. It belongs to Z Hypnotics. It acts like a benzodiazepine. Before using this medication, you should know important facts. What is its effect on sleep behavior? What are the next day effects? When should the dose of this medication be reduced? When it should be avoided? All such facts we will discuss in this video. First, let us see how this medication works. Zaleplon works like benzodiazepines. However, it is not a benzodiazepine. It is a hypnotic that is not related to benzodiazepines but still works like them. It can bind to the GABA benzodiazepine receptor complex, where it acts as an agonist and increases the activity of the GABA. Even though Zaleplon is not a benzodiazepine, it still has an affinity towards benzodiazepine receptors. On these receptors, it can bind and activate as an agonist. This results in the increased binding of GABA to the GABA receptors, leading to the opening of chloride channels. Chloride ions can enter into the membrane, which produces hyperpolarization and reduces the neuronal activity. This can bring sedative and hypnotic actions. This medication has a half-life of 1 hour, and its duration is much shorter compared with other hypnotics. How to take this medication? Zaleplon is available as capsules at 2 strengths, such as 5 mg and 10 mg. For treatment of insomnia, it can be used for the short term. The dose of this medication depends on your conditions, your liver functionality, and any other medications that are co-prescribed. Typically, it can be started at a dose of 10 mg given orally. However, in people with low body weight, the dose may be reduced to 5 mg. Therefore, the proper dose depends on your individual conditions. In people where it is ineffective, the dose may also be increased to 20 mg per day. If you have decreased liver function, your doctor may reduce the dose of Zaleplon to 5 mg. However, in severe hepatic impairment, use of this medication is not recommended. In people with any renal impairment, no dosage adjustment is required. Zaleplon is a lipophilic substance. When you take this medication into your body, only 30% of the medication is available for its action. It indicates that this medication is highly metabolized in the liver. The metabolism of Zaleplon is mainly carried out by one of the enzymes called aldehyde oxidases. By action of this enzyme, it can produce one of the metabolites, 5-oxo-Zaleplon. This is an inactive metabolite that cannot induce sleep. To a lesser extent, it is also metabolized by CYP3A4 enzymes. Due to its metabolism, the Zaleplon produces few of the inactive metabolites, which have no action on the induction of sleep. Therefore, the metabolism of Zaleplon is crucial, and any other factors that are going to increase its metabolism may have a significant effect. When you take Zaleplon, it is rapidly and completely absorbed. However, the bioavailability of this medication is low, and around 30% of this medication only reaches into the CNS. This indicates a high metabolism in the liver. You can take this medication with food. However, a high fat may reduce the absorption. This may produce a delay in the onset of its action. Therefore, when you take the Zaleplon along with a high-fat meal, the induction of sleep may be delayed, which may produce the next day's drowsiness. If you're taking cimetidine along with Zaleplon, the dose of this medication should be reduced. Cimetidine inhibits the metabolism of this medication by blocking the activity of the CYP3A4 and aldehyde oxidase enzymes. Therefore, when you take Zaleplon along with cimetidine, the metabolism of Zaleplon is reduced, leading to increased levels of this medication in your body. This may produce significant drowsiness and other central effects. Therefore, the dose of this medication should be reduced to 5 mg in the presence of cimetidine. What are the precautions to be taken? Zaleplon can decrease the time to sleep onset. It facilitates the induction of sleep. However, it is not increasing the total sleep time. Therefore, you have to maintain sufficient sleep hours when you're going to take this medication. Even this medication is not reducing the number of awakenings during sleep. It only helps in the induction of sleep. This effect can also be observed for a short term, up to 30 days. If you do not observe any improvement in the sleep induction, even after 7 to 10 days of treatment with Zaleplon, it may indicate any other disorder that produced a disturbance in your sleep. In such conditions, further evaluation should be done to check for any presence of other psychiatric disorders. You should always use this medication properly, and it should be taken at bedtime with a sufficient number of sleeping hours. If you're taking this medication with reduced sleeping time or at midnight, it may produce the next day drowsiness. Zaleplon may produce a few complex sleep behaviors. These effects can be observed even at the normal dose that you're going to use. They can also be observed when you take other hypnotics along with this medication. In people who are experiencing complex sleep behaviors after taking Zaleplon, use of this medication is not recommended. Complex sleep behaviors include sleepwalking, sleep driving, or engaging in a few of the actions without full wakefulness. This may result in accidents and serious injuries. Therefore, if you observe such complex sleep behavior, this medication is not recommended for you. A few other CNS depressants may also increase these complex sleep behaviors. When you're using CNS depressants, the dose of Zaleplon should be modified because it may produce additive effects resulting in significant drowsiness and sedation in people with mild to moderate hepatic impairment. This medication should be used carefully. If you have any severe hepatic impairment, use of Zaleplon is not recommended for you. Zaleplon can produce drowsiness, and it can reduce your level of consciousness. This effect can be more pronounced, particularly in the elders. This may increase the risk of falls. Therefore, during the early days of the therapy, you should be cautious to avoid any risk of falls. If you have any history of depression, this medication may produce a worsening of the condition. It may also increase the suicidal thoughts and abnormal behavior. Therefore, if you observe any enhanced depressive symptoms with the use of Zaleplon, this drug may be discontinued. Zaleplon can induce next-day psychomotor impairment. It may impair your driving performance. This situation depends on how you are going to use this medication. If it is taken with less than a full night of sleep, it may induce next-day effects. You should take this medication with a sleep time of at least 7 to 8 hours. If you are using this medication at higher doses than recommended, again, the next day effects can be more pronounced. Use of other sedatives and hypnotics along with Zaleplon is not recommended due to their additive effect. If you're using this medication in the middle of the night, it may produce drowsiness on the following day. Use of other CNS depressants, such as alcohol, can also increase this condition. Zaleplon may also produce loss of memory. Never stop this medication suddenly as it induces withdrawal symptoms. If you want to stop this medication, you should gradually reduce the dose, particularly when you're using it at higher doses. Now let's see the side effects of this medication. One of the common side effects is the headache. It can also produce dizziness and lightheadedness. You may have abdominal pain and weakness. A temporary loss of memory can also be observed. You may perceive eye pain and loss of sensation. Nightmares can be observed in a few people who take this medication with a short sleeping time. That's all about Zaleplon and important facts that you should know. Thanks for watching this video. Please share your experience and how it works for you in the comment section below. Have a great day.